Welcome! In this lesson, we'll review how to create count measures that enumerate entities. Entities are things that exist across time and are not bound by a single moment or interval. Generally, when working in Ursa Studio, entities are patients. However, a health plan or provider could also serve as an entity. We'll start our lesson in Measure Workshop. As in previous lessons, we'll use a template to create this measure. We can select the Count of Entity N template from the dropdown. First, we'll define the object that has the entities we'd like to count. You can type ahead to find the object, which for this measure is this CKD Patient Timeline Master object. After selecting the object, the system correctly auto-detected the choices for the next three fields. If it hadn't, we could simply enter the correct case identifier and start and end dates. The Case ID field uniquely identifies the entity to be counted, and the period start and end date fields identify the time interval associated with the patient in the timeline object. The timeline intervals associated with the patient inform the system what reporting periods the patient should be counted within. We'll call this measure Count of CKD Patients, and we'll use CKD P01T as the identifier. The measure domain field is already associated with the correct domain, populations, though we have the opportunity to change this if needed. The requirements we just entered, as well as additional details concerning the measure, are here for our review. Before we select the Create Measure button, it's worth noting that although this does create the measure, it does not automatically save it. We'll get to that in a moment. When we select the Create Measure button, we're redirected to the Measure Properties screen. Here, we'll need to update and confirm the measure name and set the ranking field before the measure can be saved. Let's address these open items so the measure can be saved. With count measures, the measure's name and nickname are often the same, so we'll go ahead and copy the nickname into the name field and click this check mark to confirm that we've reviewed the measure's name. We'll also enter a measure description that describes which patients are being counted and how. Next, we can select our ranking field or the field that the measure's case level grain is sorted on. We'll specify the direction by which the ranking field is sorted with the ranking direction option. We'll sort this by the patient identifier field in ascending order. We've now addressed the two outstanding tasks that we needed to complete before saving this measure. But before we actually save it, let's review a few additional items related to the measure that will provide insight into how the measure is constructed. As we've noted before, it's always good practice to check the Published Fields panel to see if there are fields that you'd like the measure to report. For this lesson, I'm going to select and then unselect the Inherit Field Settings from Object checkbox to pull all fields into this measure. Generally speaking, a more carefully curated approach to field selection might be useful, but it's not necessary in this case. The Entity Effective Dates panel is where we find the entity effective start and end date fields. These are the fields that we completed when filling out the template. It's worth unpacking them a little bit because this measure utilizes the CKD Patient Timeline Master object for counting the number of CKD patients per reporting period. When a timeline object is created, an entity, in this case the patient, is assigned start and end date periods associated with various events and intervals related to the patient's status and care. For example, this timeline object reports, among other things, the time periods that the patient is associated with various stages of CKD. The measure's temporal structure, which we'll discuss next, uses these effective start and end date fields to determine when a patient should be counted for each reporting period. So let's talk about the timeline snapshot temporal structure. This structure is used when a measure's observations represent entities, which exist across time and whose performance is measured on recurring snapshot dates. To use an example outside the context of a count measure, imagine a health system is offering a program for COPD patients. We want to create a measure to capture the percentage of patients enrolled in the program over time. Here, we could set our snapshot date to be the first of each month, and on that date, we would tally the number of patients enrolled in the program. The following month, on the 1st, we would tally the number of patients again, and so on. So, this temporal structure takes a figurative snapshot on a predetermined date. In the case of the measure we're creating, on the snapshot date, the measure will tally how many patients are CKD stage 1 or higher. Whether a snapshot date occurs at the beginning or end of a reporting period is a parameter set at the report level and is not configured with the measure. Next, we can briefly review the measure's numerator and denominator contributions. The numerator contributes the count of 1 for each patient found in the numerator base object, the CKD patient timeline master. The measure's denominator equals 1 for each snapshot date reported. If this measure only reported one snapshot date, the denominator contribution would be 1. If the measure reported 3 snapshot dates, the denominator contribution would be 3, and so on. To tie these contributions together, if on a single snapshot date, let's say October 1st, the measure counted 754 patients, the measure's numerator would contribute the count of 754, and the denominator would contribute the count of 1 for the single snapshot date. So the measure's results would calculate 754 over 1, which resolves to 754. Hopefully, this gives you a better idea of how measures that count entities are constructed. Let's go ahead and save this measure and add it to a report. From the Measure Workshop home screen, we'll open Report Manager and add this measure to the CKD Analytics report. As you can see, this report already contains a PM-PM measure for CKD patients, and we can add the count measure that we just created. Because this is the first measure with a timeline snapshot temporal structure added to this report, a new field has been added to the Report Parameters section that enables us to specify when the snapshot counting patients will be taken. We can select the Start of Period option, then save and run the report. After the report runs, we can open it in Analytics portal by selecting this link. From here, we can open and explore the new measure that we've created. So that's it for this lesson. You now know how to create a measure that counts entities using the Count of Entity N template. Thank you for taking a moment to review this lesson.